What do you think about when you hear about UK veteran? Do you think this? Or this? Or maybe even something like this? Hello, I'm Dr. David Hindmarsh of GP Templates. I've been serving in the military now for the past 11 odd years or so. I've written an article for Innovate with Colonel Mike Smith, and that was written about a couple of years back, which goes through some key bits, and we'll use that article as our main basis for how we're going to deal with our military veterans. Now, military veterans provide an interesting population. They account for about 8% of the UK population, with, as I've said, working in garrison towns or where you've got a large base beside you, that actually may be significantly higher. Wow. This can also become a veterans associate practice, and the RCGP have done a lot of work in terms of promoting really good learning topics, and I'll leave a description below for that. So let's go into administration first, or about the leaving process from a military point of view. Because I'm in the army, this will be a lot of this will be an army taint, so just ask them about how their leaving process went. Normally what will happen is that you'll ask that service person will have about a year to give or year to serve prior to them actually physically leaving the service. They'll pick a date and they'll put what's called in the clicks. So on the administration system, they'll say, yes, I want to leave, and then they'll start the necessary interview processes, de-kitting process, and also resettlement processes. So the resettlement processes are a series of courses that are aimed to hopefully get them a job in civilian life, okay, which may include sort of shadowing interviews, CV prep, maybe learning new skills and trades that will sort of aim them to prop them so they've got something to fall back on in military life. From a medical aspect, two things should happen. They should have what's called a pre-release medical and a release medical. Pre-release medical happens anywhere between 8 to 12 weeks prior to them physically leaving the service, because until they've physically left, their medical care is still under military control, for want of a better description. At that pre-release service, there is a set format that should generally be completed. The first part is just a quick summary of their notes. Have they had any notifiable injuries during their military service? Are they leaving with any sort of problems? And then there'll be a set of screening examinations done. This would normally be height, weight, blood pressure, what you would expect, urine screen, eye test, and also an audiometry. Now, audiometries happen on a regular basis, anywhere between 1 year and 2 years in the military, because obviously being exposed to loud noises, certainly with rifles being the obvious example, means that we need to keep a very close eye on them. The reason as well why we give 8 to 12 weeks is that it gives a really good chance that if we need to refer onwards, say to secondary care, or we need to wrap up this care, that we've got it's our last stop really prior to them releasing service. And that way it shows that the military is looking after them and that we're sort of not passing unnecessary work into civilian life. There'll be a structured mental health questionnaire, which will sort of give a brief screening for anxiety, depression, any anger issues, any alcohol problems, and also post-traumatic stress disorder, PTSD. And that way, again, as I said before, with the physical issues, it'll give a last capture prior to us leaving the service so that we can actually deal with and make any necessary mental health referrals onwards. Also at that medical, there should be a grading review done as well. Now, military grading is an interesting concept and shows that there is a vast amount of occupational health work that the medical officer will do in military service. Just to briefly touch on grading, because it'll be interesting when you're sort of having a discuss, just have a quick look at it and you'll see a number of values. The one that I want you to look for is the P value, okay, and it'll either be a couple of options. It'll either be P2, which is medically fully deployable, so they're fully fit, good to go, no dramas, no issues. P3, and that's medical limited deployability. Now P3 is at the lower end of them being limited deployability, so there is likely to be a medical issue, though it's minor and easily managed. Consider your stable hypertensive who's on medication, and the reason why we downgrade them is that there is a marker there so that when they deploy, we know either from the chain of command or medically that they need to get something done prior to them leaving, i.e. maybe sort of routine blood tests or making sure they've got a full supply of medication. Now we're getting things P7. Now P7 you can either be technically limited deployability or non-deployable. Okay, more often than not you're going to be non-deployable. That means there is a significant condition going on and it's worth exploring. Now it could be that they've injured themselves, so they've hurt their knee, been quite damaged, and they're requiring a high amount of either physio or recovery to make sure that they get back to a full state of fitness, as an example. Now, they're the three broad categories you're going to be. So it'll either be medically fully deployable, P2, limited deployable, P3, or non-deployable, P7. Okay, and so have a look out at that, because that should be either in the last consultation or certainly in the last couple of months. Now, there are some different ones that we need to be aware of. When someone says they are medically discharged, some people can get them slightly confused from that way. To be truly medically discharged, that needs to be done in an occupational health board, and you'll see it as ROHT, so the Regional Occupational Health Team, and they will award a P8 medical discharge. And that means that unfortunately, the medical condition that they've got is unfit for military service. No matter how much time we give them, they will not get well enough to be back to form any military function. Classically, going back to what are stereotypes, so if you've got your bilateral amputee, any form of amputation, that unfortunately that would be awarded a P8 medical discharge. More commonly I'm seeing now it's the severe mental health, okay, so anxiety, depression, recurrent suicide attempts that are being awarded a P8 medical discharge to. They should provide you a signed copy of an FMED 133. An FMED 133 is effectively a consent form that you as the civilian GP can write to them saying, hi, I'm their new general practitioner, can I please have a copy of their medical record so that we can continue their care. Now, at time of filming, we are unable to electronically push across the military medical system along to a civilian one, regardless of the fact that we're in the 21st century, but it's one of those that at the moment that's currently being looked into with future military medical systems going forwards. I think the most important question to ask if you get face to face and there's a hint that actually military service was there, is to ask, why did you leave? Okay, now this is a very straightforward question, or something just to get that nub of the matter. As you can well imagine, being in the military adds a lot of strain, not only to the individual in terms of their mental and physical strain, but also to the family as a whole. And often those strains can be a real driving factor for them to leave the military. The separation from family can just be too much for certain people to deal with, and come to a point where, either their family can't cope with them being away or they can't cope being away. Unfortunately, I don't have any statistics for this. This falls into the very much of just what I see from the other side of the consultation, or when I'm in my uniform, that I see actually when I ask on their final medical, why are you leaving the service? And they often come out with these reasons. When not to be as worried is when they hit a pension point. Okay, so there'll often be what's called a return of service, so that you must serve so many years before you can leave on a a graduated and safely way.
So I'm going to use the last part of this video just to flag up a couple of resources that will be really useful, certainly from the administration side of things. So this Veterans Healthcare Toolkit is fantastic that the RCGP has put through. So it goes more importantly into the Armed Forces Covenant, and the main purpose of this, or one of the key highlights, is that if military personnel who have now left have suffered an injury due to their military service, that they actually get priority treatment for it. Okay, and that needs to be highlighted into any referral letters. So that's one of the key tenets of this, that basically they get priority treatment for it. Okay, the other bit is that if the patient loses their FMED 133, so they don't know where their consent form is, that actually there is a way that you can request their patient service medical records from it. The last bit that I want to highlight is the actually applying to become a veteran-friendly practice and get the Veterans Association being able to utilise that symbol on your practice. So you go to this application site, and it's a simple application form. And as you can see, as you watch more of these videos, that all the information that you need for it is in there and tied in with the e-learning that the RCGP has put out and is linked below. Then you'll be able to easily answer all of these questions. Okay, and once it's done, submit it, and then you'll get a response. So in summary, this video has covered quite a lot, mainly focused at the administration of dealing with veterans, focusing on certain key bits that you need to ask and highlighting the why did you leave process and certain flags that they can highlight from that way. We've done a brief overview of the military leaving process and how that may influence you as their now civilian GP, with really just giving more information about the military occupational health system and giving certain cues that you need to pick up on from. Finally, we touch upon RCGP resources and also application for associated status. So thank you for your time. I hope you found that useful. Please feel free to leave a comment down below, as it's really useful to gain feedback just for any future videos. And feel free to like, share and subscribe to the channel. I've been Dr. David Hindmarsh, and thank you for your time.